Hi everyone, in this video we are going to discuss about types of bed in hospital. In hospital there will be a different types of hospital according to the patient disease conditions and their physical ability, and based on the nursing care there will be different types of bed. So we'll see one by one what are the beds are available in the hospital. So the types are closed bed, open bed, admission bed, occupied bed, operation bed or post anesthesia bed or recovery bed, cardiac bed, fracture bed, amputation bed or stump bed. Last one is a burn bed. So we'll see one by one in detail. So the first one is a closed bed. So the closed bed is an empty bed which is not occupied by any patient. After the admission of patient, closed bed is converted to open bed. So when the patient is discharged from the particular room, we will be changing all the linen and will be using the new one, sterilized one we will be using, and it will be get ready to receive the another patients. So soon after we will be making the bed, that is called as a closed bed. So when some patients are coming means immediately the closed bed will be converted to the open bed. Now we see the open bed. This bed is about to be occupied by a client. So now there will be a bed, it receiving the patients, it is ready to receive the patients, that is called as a open bed. So immediately when the patient is discharged, that time if you are preparing the bed, that is a closed bed. So when the patient is get ready to enter into the room and they will be ready to be lie down in the bed, that time the closed bed will be converted into the open bed. Okay, so the next one will be the admission bed. So the admission bed, now the patient is get into the room and the patient will take a bath and they will be getting dressed into the uniform of the hospital, and they will be using that hospital ID and they will be get entered in the bed. That is called as a admission bed. Now the bed will be occupied by the admission people after changing of their dresses. The next one is a occupied bed. So this bed is for occupied by the patients. So those patients is occupied in this bed. That bed is called as a occupied bed. Here most of the patients may be in the semi-conscious, they can't able to move from the bed, and unconscious coma, these are the people always they will be occupied in the bed, they can't able to move from the bed because of the physical disability. So the next one is the operation bed, post anesthesia bed or the recovery bed. This bed is for those clients who is getting recovered from the effect of anesthesia. So after anesthesia there will be so many complications will come, like they will be getting shivering and they may go for the cardiac arrest. So the bed will be equipped with all the emergency medicines and all the emergency equipments. It should be a little bit hard and it will be giving warmth to the anesthesia patients. So like that only it will be available. So that type of bed is called as a operation bed or post anesthesia bed or recovery bed. So what is the next slide means, that is a cardiac bed. So here you can see that two type of cardiac table here. This one will be giving a along with the bed, it will be available. Sometimes we have to be moved from the separate one to the attached one. So this kind of bed help the client to attain a sitting position with the least strain and also help to relieve the dyspnea. Dyspnea means breathing difficulty. When the patient is have breathing difficulty when they are sitting, they can rest their arms in this areas, so it will be giving a comfort for the sitting position and also to relieve the dyspnea. And also this cardiac table we can use for eating and reading and writing purpose also we can use it off. So the cardiac bed nowadays it will be attached with the cot, or sometimes it will be available separately, we have to attach to it. So the next one is a fractured bed. So this bed is prepared for client with a fracture. It provides support to the fractured part using a firm mattress which rests on fractured board on a bed board. So this will be giving all the support like this, up, down, everything. So they can able to lift their limbs without any support, and they can support their arms, and they can stand up by themselves without having anyone help. So this type of bed is called as a fractured bed. So the next one is the amputations bed. After amputation means there will be removing of any one of the limbs. So after removing of any limbs, the to take off the bed linen support, we will be using this amputations bed. And last bed is a burn bed. It consists of a long bed girdle which takes off bed linen weight from all over the body. It will be giving free air circulations inside the patient's body. Mostly 70, more than 70, 60 percentage burns means we will be giving this type of bed. Okay, thank you everyone.